So, today we will discuss skeleton of foot and the arches of foot. Okay, arches of foot comes in your long question. Skeleton of foot is important for your viva table, bones viva. Okay. Okay, so foot is set at a right angle to the leg. See here, these are the two leg bones, tibia and fibula, and foot is set at right angle to the tibia and fibula. Okay. And it permits the sole to have a proper grip on the ground. The skeleton of foot is composed proximo-distally of the talus, metatarsal and the phalanges. Okay. Tarsal bones, metatarsals and phalanges, all these are tarsal bones. These are the 5 metatarsals and these are the phalanges. Okay. Tarsal bones are 7 in number, metatarsals are 5 in number and phalanges are 14 for each foot. Okay. So, this is dorsal aspect and here is the plantar aspect. See, these are the tarsal bones, talus, calcaneum, cuboid, navicular, 3 cuneiform, medial, intermediate, lateral cuneiform. These are the metatarsal, first, second, third, fourth and fifth, and these are the phalanges, 2 for the great toe and 3 each for the rest of the toes. Okay. Like the skeleton of hand, phalanges are 14 in number. And here you see this bone which is articulate with the tibia and fibula, this is talus. This bone forming the heel portion, this is calcaneum. Here is the navicular, this is cuboid and 3 cuneiforms, medial, intermediate, lateral cuneiform. Okay. So, these are the bones forming the foot. Next, so these are short bones, 7 in number and are arranged in 3 rows, talus and calcaneum in the proximal row, navicular in the middle row and 3 cuneiforms and cuboid in the distal row. 3 cuneiforms are these 3, medial, intermediate and lateral cuneiform. Okay. Next, these are the different muscle attachments. Here is extensor digitorum brevis, here is attachment of the tendocalcaneus. These are the attachment of extensor digitorum brevis and longus. Brevis is attached in the middle phalanx and longus is attached at the distal phalanx. And for the hallux, hallux means great toe, here is attachment of extensor hallucis brevis and here is extensor hallucis longus. Here is attachment of peroneus brevis and peroneus tarsius. Okay. So, this is dorsal aspect and this is the ventral aspect. Here is attachment of ligaments, important ligament, plantar calcaneonavicular ligament here. Here is the long plantar ligament, short plantar ligament. This is flexor digitorum accessorium. These are muscles of the sole of the foot. Here is attachment of tibialis anterior, here is peroneus longus, peroneus brevis. This and here is tibialis posterior. These you have seen in your anterolateral compartment of leg and here is adductor hallucis and flexor hallucis brevis. Here is flexor hallucis longus and here is attachment of 2 slips of flexor digitorum brevis and here is flexor digitorum longus and here is abductor digiti minimi and flexor digiti minimi brevis. So, these are the important muscle attachments over the different bones of the foot. Next, so you have to know talus and calcaneum in details if you want to read, otherwise you just have to identify. In skeleton of foot, you have to identify the tarsal bones. So, what will be the anatomical position? This will be the anatomical position of the foot. Okay. So, you have to place the toes in front, heel portion behind. So, anterior and posterior is determined. Now, medial lateral, how you determine this thickest and strongest metatarsal, this is first metatarsal and it is placed medially, and so you determine medial and lateral, okay, and superior and inferior, talus will be superior, okay, and this calcaneum will be inferior, posterior and inferior, okay. So this is a foot, skeleton of foot of left side, okay, understood. So anterior posterior calcaneum or heel portion posterior, toes in front, anterior posterior, medial lateral, this first thick and strong metatarsal is medially placed, and superior inferior, talus is superior, calcaneus is inferior, okay, and this concavity is directed inferiorly, okay, this concavity is known as the arches of the foot, okay. So this is a skeleton of foot of left side, that much you must know John, okay. Otherwise you can read talus and calcaneum in details, their surfaces, articulation, all these are important, okay. Okay, next, okay, so you have to identify the bones. So this upper one, it articulates with this tibia and fibula, you can see here is the articulation, tibia and fibula on their inferior surface forming a concave surface, that is known as tibiofibular mortise, okay. It articulates with this talus forming the talocrural joint or ankle joint. So here talus articulates with tibia and fibula to form the ankle joint, okay, and no other bone articulates with tibia and fibula, only talus articulates, okay. Rest this talus below articulates with this long bone, this is the largest tarsal bone, it is known as calcaneum, okay. Weight bearing point is present on the inferior surface of the calcaneum, and in front of this head, talus have a head, neck and the body, okay. Head of the talus articulates with one concave bone, that is known as navicular, okay, and this bone in front of the calcaneum, this cubic shaped bone, this is known as cuboid, and these three smaller bones, wedge shaped bones, these are known as from medial to lateral, medial, intermediate and lateral cuneiforms, okay, understood. So you will be able to identify the bones. Superior bone is the talus, articulates with tibia and fibula to form the ankle joint, here the ankle joint you can see, and below the talus this is calcaneum, this is the largest tarsal bone. In front of the talus here is the navicular, in front of the calcaneum this is cuboid, and these are the three cuneiforms, medial, intermediate, lateral cuneiforms, and these are the metatarsal bones, first, second, third, fourth and fifth metatarsals, okay, and these are the phalanges, 2 for the great toe and 3 each for the rest of the toes, okay. So total 14 phalanges, and you can see axis of the for hand, you have seen axis of the hand passes through the middle finger, okay, but for the foot this axis of the foot passes through this second metatarsal, okay, not through the third one, and this first metatarsal is thickest, strongest and stoutest, okay, and but longest metatarsal is third one, third metatarsal is the longest one, okay. Axis passes through second, the longest is the third one, and first metatarsal is the strongest and stoutest bone among the metatarsals, okay, understood. So you have to hold it in anatomical position and you have to articulate with tibia and fibula, these are asked in your viva, and the bone joints formed by it, and identify the bones, tarsal bones, okay, all this is asked from this skeleton of foot, understood. And if you want to read, you can read the muscle attachments, in the previous picture I have shown you, so that is important from skeleton of foot, okay. Next we will go to the arches of the foot, okay. अच्छा एक बार ये करो तो बैक करो और मैं जाच escape करो, Okay. So, these are the difference between the metatarsals and metacarpals. So, for the metatarsals, it is generally smaller than the base and it is directed in front, and for metacarpals, head is generally larger than the base. Here head is smaller than the base. Okay. See, for this you can see this is head, this is shaft and this is base. Okay. Base is articulating with the tarsal bones, head is articulating with the phalanges. For the metacarpals in the hand, you have seen heads are larger and here bases are larger. Okay. Shaft, it gets, for metatarsal, shaft gets narrower from base to head. You can see here shaft gets narrower from base to the head, and concave surface is directed below, here concave surface. Dorsal surface of the shaft presents no flattening. Here it is convex, dorsal surface are convex. But here in metacarpals you can see it increases in size from base to head. Concavity of shaft is directed in front. This will be the anatomical position of the hand. So, concavity is directed in front, and dorsal surface presents triangular flattening. This is important feature, and shaft, these are numbered from medial to lateral in case of metatarsals, first, second, third, fourth and fifth, and for hand you count it from lateral to medial. Thumb is the first one, first metacarpal, first, second, third, fourth, fifth, from lateral to medial. So, these are the differences between metatarsals and metacarpals. Next, next we go to the clinical aspects. Fracture neck of talus, this is important fracture of the foot. It sometimes occurs due to forceful dorsiflexion of the foot. The arteries supplying the talus enter through the front part of the neck and passes backward, and these arteries are damaged in fracture neck of talus and cause delayed union or necrosis of the posterior segment, that is body of the talus. Okay. If fracture occurs near the neck of the talus, neck is this constricted part of the talus. Okay. Arteries are entering through this neck to supply this body of the talus. So, if there is breach in the arteries, there will be necrosis of the body of the talus. Okay. And that is also known as posterior segment. Next we go to calcaneum fracture. It occurs when a person falls on its heels from a considerable height, and the calcaneum breaks into a number of pieces and fracture lines usually run vertically. Okay. Next is fracture of tuberosity or styloid process of fifth metatarsal. Here you can see this fifth metatarsal has a proximal projecting part here. This is known as styloid process of the fifth metatarsal. So, fracture occurs here, it usually occurs due to forced inversion of the forefoot, and when the tendon of peroneus brevis pulls of the styloid process leading to its avulsion. And this fracture is also called Jones fracture, after the name of orthopedic surgeon Sir Robert Jones, and who himself sustained this injury. Okay. And March fracture, it typically occurs in the shaft of the neck of the second and third metatarsal due to aggressive prolonged march fast by the shoulders. Okay. So, March fracture occurs in the shaft or neck of second and third metatarsals. Next, the base of the second metatarsal is most fixed or secured because it fits into the mortise formed by three cuneiforms. See here, these three cuneiforms are forming a mortise. Mortise means a concave shaped space where the base is attached, base of second metatarsal is attached. That is why it is most fixed or secured, and for this reason the axial line of foot passes through the second toe, and movement of adduction and abduction of the toes are mentioned with reference to the second toe. That is why the axis is important. Adduction means fingers are going towards the axis, and abduction means going away from the axis. Okay. So, here axis passes through this second metatarsal. So, in reference with this metatarsal you have to consider adduction and abduction of the toes. Okay, understood. Next we will go to arches of the foot. This concavity you see, this is known as arch of the foot. Next and this arching of the foot is important for our weight transmission and helps in walking. So, we will discuss under these following headings. First the introduction, then classification of arch. These are the different arches: medial longitudinal arch, lateral longitudinal arch, proximal transverse arch, distal transverse arch, and mechanism of arch support, how these arches are supported, and deformities of foot. Okay, these are the points we will discuss. Next, these are the footprints you can see over the sand. These footprints are formed due to these arches. Okay, these points are the pressure points. Here in front there are some pressure points in front and some pressure point behind. Okay, and this middle portion does not carry any weight. Next, so what are the functions of the arches of the foot? Arches of the foot is distinctive feature of human, helps in walking, running and jumping. It helps in weight bearing in upright postures, and footprints are complete due to the arches. It is present since birth but masked in infant due to presence of fat pad over this sole of the foot. Okay, in infants you cannot see the arches prominently because of the fat pad in infants. So, and the medial longitudinal arch gives a propulsive force during locomotion. Okay, and the lateral longitudinal arch functions as a support and weight transmission. So, these are the main functions of the arches of the foot. Next, why there are arches? A segmented structure can hold up weight only if it is built in a form of arch. Okay. Our foot is not a single bone, foot consists of multiple bones. So, how it will carry the weight? If it is a single bone, whole of the weight will be transmitted through the single bone. But if it is formed by multiple bones, you have to form a arch like structure to carry the weight. Okay, so it helps in weight transmission. Weight will be distributed on the heel. See, this is, it will be distributed towards the heel behind, and two heads of the metatarsal bones in front here, heads of the metatarsal. These are the pressure points. Pressure will be minimized on the nerves and vessels in the sole. In the sole there is multiple muscles, vessels and nerves. Okay. Medial and lateral plantar vessels, medial lateral plantar nerves, all this will be compressed if there is no arch. Okay. That is why in flat foot these arches are lost and there will be pain due to the compression of the nerves. Okay. And forward propulsive action will be easier if the arches are present. So, helps in locomotion. Next, so these are the bones forming the foot, you can see here. This tibia and fibula articulating with this bone, this is talus. Here is the calcaneum, this is navicular, here is cuboid, and these are the three cuneiforms: medial, intermediate, lateral cuneiform. Here are the metatarsals, first, second, third, fourth and fifth metatarsal. Here is styloid process of fifth metatarsal. And these are the phalanges, 2 for the great toe, 3 each for the rest of the toes. Okay, understood. So, these are the bones forming the foot. Next, we have divided the foot in these 3 divisions: forefoot, midfoot and hindfoot. So, this part is the forefoot, here is the midfoot and this part is hindfoot. This talus and calcaneum is forming hindfoot, this part up to the metatarsals is forming the midfoot, this rest of the tarsal bones. These are forming the midfoot, and these metatarsals and phalanges are forming the forefoot. Don't talk, sit silently or leave, don't disturb in the class. Next. So, 3 anatomical and functional divisions. Hind foot is formed of this talus and calcaneum. Here 3 individual colors have been used, talus, calcaneum forming hind foot. Midfoot is formed by the navicular, cuboid and cuneiforms, and forefoot is formed by the metatarsals and phalanges. So, these are the 3 divisions of foot, functional divisions and anatomical divisions. Next, these are the weight bearing points. Weight of the body is spread among these 3 points. Posterior inferior tuberosity of the calcaneum, here tuberosity of calcaneum forming the heel, head of the first metatarsal here and head of the fifth metatarsal. These are the 3 important pressure points for weight bearing. Okay, understood? Next, this is tuberosity of the calcaneum. This is sesamoid bones of first metatarsal and head of second metatarsal, and these are the heads of third, fourth and fifth metatarsal bones. So, here weight is transmitted. Next, so this is the distribution of weight. You can see here, if body weight of a person is 120 pound, it is divided half in 2 foot. Right foot is carrying 60 pound, left foot is carrying 60 pound. First it comes to the talus here. From talus it is divided into 2 directions. Posteriorly it goes to the calcaneum, anteriorly goes towards the head of the 5 metatarsals. So, here also half of division occurs, 30 pounds in calcaneum, 30 pounds in head of the 5 metatarsals. And this 30 pound is divided like this, 4 metatarsals plus 2 sesamoid bone under the hallux, each 5 pound, each have 5 pound. So, 6 bearing point, 4 head of metatarsals and 2 sesamoid bone under the hallux here. Under this first metatarsal there is 2 sesamoid bone, these 2 individually act as a weight bearing point. So, 1, 2, 3, 4, 5, 6, 6 bearing points, each carrying 5 points, 5 into 6 is 30 pound. Okay. So, this is how weight is distributed. Next, so what are the factors maintaining these arches? Arches are like stone bridges. You have seen stone bridges like this. So, the bones are wedge shaped, they are like the shape of the stone. See, this is talus, here is calcaneum, this is navicular. So, these tarsal bones are shaped like stones and there are intersegmental ties here. These are the intersegmental ties, these are formed by the, also known as staples, formed by the different ligaments of the foot. And there are slings. Slings are formed by the tendons of the muscles, they pull stuff from upward. And there are tie beams are connecting the 2 ends here. These are also formed by the some tendons and some ligaments. Okay. So, we will discuss what are the factors for individual arches. Okay. These arches of foot very important for your long question. You can be asked medial longitudinal arch, factor maintaining the arch, structures forming the arch like this, or you can be asked lateral longitudinal arch or transverse arch, they can individually come as a short note. So, these are the classification of arches of the foot. 2 longitudinal arches are there and series of transverse arches. আর একদম ফোন বের করবি না, ফোন ব্যাগের ভিতরে রাখ, ব্যাগে রাখ। 2 longitudinal arches are medial longitudinal arch, lateral longitudinal arch. Series of transverse arches, anterior complete part, there is a posterior incomplete part. These are the divisions of transverse arches. Next, see 2 longitudinal arches, medial and lateral. See this yellow colored outline, these are representing the bones forming the medial longitudinal arch, and the blue line, it represents the bones forming the lateral longitudinal arch. So, this part talus and calcaneum, these two are common to both arches, medial and lateral. Okay, so, you have to see which bones are forming the medial and lateral longitudinal arches. So, you can see talus, calcaneum, navicular, 3 cuneiform and first, second, third metatarsals, they are forming the medial longitudinal arch. This talus, calcaneum, cuboid and this metatarsals, 4th and 5th metatarsal, they are forming the lateral longitudinal arches. Next, so medial longitudinal arch, this is view from the medial aspect. Okay. This is the arch, medial longitudinal arch formed by the, so medial longitudinal arch, you can see in your foot, medial arch is higher than the lateral arch. Lateral arch is not that much prominent. So, medial arch is higher and important than the lateral, composed of these bones, calcaneum, talus, navicular, 3 cuneiforms, 3 metatarsals, and talar head is keystone of this arch, head of the talus. This part is the keystone. Keystone means the highest point, it is formed by, it is the highest point of the arch. Okay, you can see from this picture. Next, so medial longitudinal arch is higher than the lateral arch formed by the calcaneum, talus which forms the keystone, navicular, 3 cuneiform and first 3 metatarsal bones. All these are forming the medial longitudinal arch. Next, lateral longitudinal arch, see this is the view from lateral aspect. So, these are the bones forming lateral arch. It is lower than the medial arch formed by the calcaneum, cuboid, here cuboid is forming the keystone and 4th and 5th metatarsals. Okay, all these bones are forming the lateral longitudinal arch. Next we go to the transverse arch. It is half arch. You can see this arch. This is half and another foot is forming the half of the arch. So, when you place 2 feet together, this transverse arch is complete. Okay. So, see here, it is only half of the arch, this is the transverse arch formed by bases of metatarsal bones, cuboid and 3 cuneiforms here. Bases of the metatarsals, cuboid and 3 cuneiforms, these are together forming the transverse arch. Okay, understood? Next, see here, this is lateral longitudinal arch or outer arch, medial longitudinal arch or inner arch. Okay, this is higher, medial longitudinal arch is higher than the lateral. Next, so this is the point of the arch. Here is the medial longitudinal arch, this is lateral longitudinal arch and this is transverse arch. Okay, anterior transverse arch. Next, so this is transverse arch which is half in each foot. This is transverse arch and this is anterior arch, anterior transverse arch. It is formed by the metatarsal bones, head of the metatarsal. This is a complete arch. Next, see this is the structures forming the arches. This shaded portion is forming the lateral arch. This portion is forming the medial arch, medial longitudinal arch. Next, here also the color coding has been shown. This is forming the medial arch, calcaneum is also included and these are forming the lateral arch, the red colored one. Here you can see the location. This is medial arch, high arch, this is lateral arch or external longitudinal arch and this is representing the transverse arch, okay, or anterior arch. Next, so what are the factors maintaining the arches of the foot? These arches are maintained due to shape of the bones, strength of the ligaments and to tone of the muscles. Next, so bones and ligaments are static stabilizer, they does not change, and muscles and tendons, their positions are changed, these are known as dynamic stabilizers. So these are the factors that maintains the arch. This comes as a question, what are the factors maintaining the arches? Next, and this is different for all the arches. Bones are different, ligaments are different, muscles and tendons which are involved in maintaining the arch are different for medial arch, for lateral arch, for transverse arch. So you have to remember like that. So method how these factors are maintaining the arches, this is arches are maintained due to shape of the stone, they are wedge shaped, okay. Outer portion is, outer margin is enlarged and lower margin is shorter. So you can see the bones are wedge shaped. There are intersegmental ties, these are known as staples, these are the intersegmental ties which keeps the bone in a arched manner, these are formed by the ligaments. And here there are tie beams are connecting the two ends of the arch, these are formed by the tendons of the muscle. And there are slings or suspension bridge here, these structures are pulling the bridge from upward. So this is also formed by the tendons of the muscle, slings. Next, see here, this is lateral arch. Lateral arch is maintained by this sling, here sling action or suspending the arch from above by this peroneus longus tendon, okay. And this is the sling for this bridge, it is pulling the bridge from upper aspect. Next, shape of the bones. Bones are wedge shaped with the thin edges lying inferiorly, and this applies particularly to the bone occupying the center of the arch, that is keystone here, keystone. And we have read keystone is formed by the talus for the medial arch, okay. So this is wedge shaped, you can see the shape of the talus and lying between the calcaneum and naviculum. Okay, so this wedge shaped structure is also helping in maintaining the arch. Next, so bones are wedge shaped with the thin edges lying inferiorly, and this applies particularly to the bone occupying the center of the arch, that is keystone. Next, this staple actions. So inferior edges of the bone, they are tied together like staples or intersegmental ties. So these are the stones, they are kept together by this staple like structure, okay. These are known as intersegmental ties. You can see there are plantar ligaments. Here is the long plantar ligament, this is short plantar ligament, here is plantar calcaneonavicular ligament, okay, or spring ligament. All these are acting as the intersegmental ties or staple like structure, okay, keeping the bones together. Next, so intersegmental ties of the bones, they are formed by these ligaments for these arches. So for medial longitudinal arch, it is plantar calcaneonavicular ligament and tibialis posterior. For lateral longitudinal arch, long and short plantar ligaments. তোর পাশের জন কি করছে রে, ঘুমাচ্ছে, ডাকতো ওকে, হাত দিয়ে ডাকতে পারছিস না, কি করছিস তুই, ঘুমাচ্ছিস ক্লাসে, ঘুমাসনি রাত্রে, কি করছিস? So lateral longitudinal arch is formed by long and short plantar ligament, and transverse arch, for the transverse arch, these ligaments are acting as intersegmental ties. Deep transverse ligament, transverse head of adductor hallucis and dorsal interossei. Okay, all these are acting as intersegmental ties. Next, see these ligaments. Here is the short plantar ligament, this is long plantar ligament, here is change হয়ে গেল তো. So this is short plantar ligament, long plantar ligament, plantar calcaneonavicular ligament, here is the deltoid ligament, these are medial cuneo, this is connecting the calcaneum and the cuboid, calcaneo-cuboid ligament, okay. And these are connecting the tarsal bones. So all these ligaments are acting as intersegmental ties. Next, okay, so you can see here the tendon of peroneus longus, it was acting as a sling, and on this side here is tibialis posterior. So tibialis posterior helps in keeping in position the medial arch, and peroneus longus acts as a sling for the lateral arch. Next, tying the ends of the arch together like a tie beam. So what structure is acting as a tie beam? Tie beam tendon of flexor hallucis longus, okay, for the medial arch. For the medial arch, this tendon of flexor hallucis longus is acting as a tie beam. Tie beam was connecting two ends of the arch. Next, here you can see tying the ends of the arch together, tie beam, here flexor hallucis longus tendon acting as a tie beam. Next, so tying the ends of the arch together, tie beam action is present. For the medial arch, plantar aponeurosis, medial part of flexor digitorum longus and brevis, flexor hallucis longus, flexor hallucis brevis and abductor hallucis, all these acts as a tie beam. Main action is by flexor hallucis longus. And for lateral longitudinal arch, plantar aponeurosis, lateral part of flexor digitorum longus and brevis, abductor digiti minimi, flexor digiti minimi, all these are acting as a tie beam. And for transverse arch, peroneus longus acts as a tie beam. Okay, understood? Next, see, this is sole of the foot, this is plantar aponeurosis, okay, and these are the muscles covered by the deep fossa, and these are the vessels you can see, digital vessels, digital nerves, this is lateral plantar nerve, medial plantar nerve, okay. Next, these are the different short muscles, this is flexor hallucis brevis tendon, and these two sesamoid bones are developed in these two heads of this flexor hallucis brevis. Here is the adductor hallucis, it has two heads, oblique head and transverse head, and this is flexor digiti minimi brevis, okay. Next, these are the muscle of the sole of the foot, abductor hallucis on the medial side, abductor digiti minimi on the lateral side, and this is flexor digitorum brevis divides into 4 tendons for this 4 toes. Next, now we will discuss the slings or structures suspending the arch from above like a sling. Here peroneus longus is acting as a sling. So suspending the sling was suspending the arch from above. For medial longitudinal arch, tibialis anterior, tibialis posterior, medial ligament of the ankle joint, all these are forming the sling. And for lateral longitudinal arch, peroneus longus and brevis is forming the sling, and for transverse arch, peroneus longus is forming the sling, okay. So if long question comes, you have to write which structure, shape of the bone, structure forming the intersegmental ties, structures forming the sling, okay, structures forming the tie beams, all those you have to write down point wise to describe structures for supporting each arch, okay, understood. Next, you can see here this is tibialis anterior, it is forming a sling for this medial arch. Here you can see the flexor hallucis longus, flexor digitorum longus, tibialis posterior for the lateral arch, Okay. Next, this is for the medial arch, okay, and for the lateral arch, these two muscles, peroneus longus and peroneus brevis, these are forming the sling. Next, here you can see lateral arch maintained by this, sling action is done by these two, tendon of peroneus brevis, tendon of peroneus longus, understood? And these are the intersegmental ties, short plantar ligament, long plantar ligament, and here lies the tendon of peroneus longus, which is also acting as a sling for the transverse arch, maintaining the transverse arch. Next, see the position of peroneus longus, it is winding round the lateral border of the foot and going to be inserted over the medial cuneiform and base of the first metatarsal, and this is tendon of tibialis posterior, it is also inserted over the cuboid, some part in the calcaneum, and also going towards the base of the metatarsals. And these are the plantar interossei, P1, P2, P3. Next we go to the clinical aspect. So, you have seen the factors maintaining different arches, you have to know the classification of arch, 2 longitudinal arch, 2 transverse arch. 2 longitudinal arch is medial and lateral longitudinal arch, 2 transverse arch, posterior transverse arch is half in each foot, anterior transverse arch is also known as metatarsal arch, this is formed by head of the metatarsals, okay. And you have to know what are the factors maintaining all these arches, due to shape of bones, due to action of the muscles and ligaments which are forming the tie beams, intersegmental ties and slings, which muscle and ligaments are involved in which action you have to know, okay. This is important for long question, and all these clinical aspects, these are also important, they comes as a part of long question, 2 marks question, or individually comes as a short note, okay, understood, these clinical aspects are important. So, first is pes planus or flat foot, a condition in which the medial longitudinal arch is depressed, the forefoot is everted, head of the talus is forced downward and medially, and the causes are both congenital and acquired. So, this is flat foot. So, arches are lost in flat foot. Next, see here, this is normal foot, arch is normal, this is flat foot, see arch is diminished. So, here normal arch is diminished, this is flat foot, and this is claw foot, here it is high arch foot, okay, height of the arch is increased. This occurs in congenital talipes equinovarus, CTEV, okay. Next, this is normal foot and normal arch, this is flat foot or flattened arch, here you cannot see the arch here, okay, there will be pain mainly in flat foot. Left foot lateral view. Next is pes cavus, flat foot was named as pes planus, okay, and this is high arch foot also known as pes cavus, this is normal arch, this is high arch is more, height of the arch is more, pes cavus, this is also a deformity of the foot. This is normally we get this as a footprint, and in pes cavus you get a footprint like this, okay, lateral arch is not touching the ground. Next, this is normal foot, flat foot, footprints are. Next, okay, so in normal foot position, in excessive pronation, in flat foot there is excessive pronation, so it is on the inside edge of the sole. Generally it is on the outer side of the sole, and in case of flat foot, weight is transmitted more through the inside edge of the sole. Next, this is club foot. Oh, club foot is also a deformity of the foot. This is normal foot, club foot. Next, what is club foot? There will be cavus. Cavus means high arched foot. Adductus, forefoot will be adducted. Varus, there is varus and equinus. Okay. Equinus means high arched. This hind foot will be high above. Equinus means like the horse, it is present in horse. Equinus word is coming from horse, and varus means it is deviated medially, that is why name is varus. So, that is why it is known as, it is generally congenital. Congenital talipes equinovarus, equinus varus, talipes means talus and calcaneum is mainly involved. Next. So, these are the different varieties of the club foot or talipes. Club foot is also known as talipes. Talipes cavus, that means there is only high arched foot. Talipes equinus, heel is high up like the horse. Okay, so this is talipes equinus. Talipes calcaneus, forefoot is not touching the ground, only the hind foot is touching. That is known as talipes calcaneus. Next, talipes valgus, it is more everted, foot is more everted. Okay, lateral arch is not touching the ground. Talipes, and this is talipes valgus. Okay, valgus means away and varus means inward. So, foot is inverted, talipes varus, and this is talipes cavovarus. That means there is cavus and varus. Talipes equinovalgus, but there will be talipes equinus, heel will not touch the ground, and there is also valgus. Okay, that means foot is everted also. Talipes equinovarus, it is equinus, that means heel is not touching the ground, and there is also varus. Varus means inverted, and this is talipes calcaneovalgus. Calcaneum is touching the ground, forefoot is not touching the ground, and valgus means everted. Okay, and here it is inverted, talipes calcaneocavus. Talipes means talipes calcaneus means hind foot is touching the ground, forefoot is above the ground, and cavus means high arched, it is high arched. Okay. So, these are the different varieties of the club foot. Okay. And so, all these four things is not present in same person. So, there is different combination, there will be different name. Okay. Understood? In the next diagram you have seen, there will be cavus and adductus, cavus and varus, cavus and equinus. There is different combination, so there will be different name. So, club foot have these deformities, but they are not present in the, all of them are not present in the same person. Okay, understood? So, what are the parts can be present in club foot? Cavus, adductus, varus and equinus. Understood? Next, all this we have discussed. So, here hind foot and ankle. So, inversion in the subtalar joint complex, it has been shown here. Equinus, equinus means forefoot is touching the ground, hind foot is not touching the ground. Adductus means forefoot is adducted. Cavus means high arched foot. Okay, plantar flexion of the forefoot on the hind foot, and adduction, adductus, that means forefoot is adducted on the midfoot. So, these are the four component of congenital talipes equinovarus, CTEV. This comes in your anatomy short note, also important during your surgery and orthopedics. Okay, very important case, congenital talipes equinovarus. Okay, understood? Components are very frequently asked. Next is hallux valgus. Valgus means deviated outward. this great toe is deviated outward. This is normal great toe. In this case, great toe is deviated outward and there is a prominence formed here. Okay. So, this is known as hallux valgus. Next is hammer toe. Hammer toe, it is blunt, this great toe is blunting and forming like a hammer like structure. Next, okay, that is all. So, all these clinical aspects are important for your short note and also part of the long question. And all these arches you prepare for your long question, factors forming, bones forming the arches and structures, factors maintaining the arches. These are very important for long question, and structures, anatomical position of the skeleton of foot, and have to identify the bones forming the foot. Okay, understood? These are important for your bones fiber. So, you will be able to hold it in anatomical position. This will be the anatomical position. Hold with this calcaneum like this, okay, and hold with the same hand to which side it belongs. It is left foot, so I have hold it with left hand, hold it with this calcaneum or heel portion. So, calcaneum will be posteriorly directed, toes are directed anteriorly, talus will be above. So, anterior, posterior, superior, inferior is determined, and medial and lateral, great toe will be medially placed and concavity will be downward. So, this will be the anatomical position of the skeleton of foot, and this is a skeleton of left foot. Okay, understood? And this talus articulates with the tibiofibular mortise to form the ankle joint. Understood? Okay, so tomorrow we will discuss the ankle joint and other joints of the foot.